There's a new law in Ohio that will soon allow you to refuse medical treatment if you're dying.
The Do Not Resuscitate law was created to clear up the uncertainties caused by the living will, which is sometimes overlooked in emergency situations. According to the state, a competent patient can refuse medical treatment. And if caregivers revive patients against their will, it would constitute battery. We investigate the new law in part 2 of Living Will's Dying Wish.
Ativan 3. You want to do an AccuCheck while I get the Ativan drawn up? Coming through.
An urgent case in the ER. Doctors and nurses act swiftly to save a life.
144 or 60.
Dr. Dave Romano is the head of Springfield Mercy's emergency department. He knows that not every patient wants to be saved. For someone with a terminal illness who wants to die, debate about saving their life can lead to suffering.
It's kind of tough. You need to do things for a patient right then. I mean, this isn't the time where you've got 4 or 5 or 10 minutes to have a philosophical discussion. And you have two people that are basically, you're frozen in between.
Without knowing if a patient wants to live or die, relatives sometimes argue about what their loved one would want. That leaves Dr. Romano in the lurch.
Had people tell me, do everything or you're going to be in trouble, and their brother or sister, same room, telling me don't do anything or you're going to be in trouble. And of course that's a fairly intolerable position.
To avoid that kind of confusion, lawmakers passed the Ohio Do Not Resuscitate bill.
To me, DNR is someone who has elected, especially in the pre-hospital care arena, not to have airway, breathing, circulatory support.
This group of medical professionals is turning the law into guidelines that can be followed every day. When they're done, those guidelines will give emergency caregivers standard notification of a person's decision not to be revived. How does a person get a DNR? The process starts with a formal order signed by the patients and doctors. And to be sure medical people carry out their wishes wherever they go, the patient can also carry a wallet card or wear a special necklace or bracelet.
Let me just take a look and see.
When emergency personnel are presented with this identification, they are required to comply. So next year, patients, not the system, will be in control of their future.
It'll give them choice. They'll be able to sit down with themselves, with their family members, friends, if that's appropriate, and especially with their physicians, and make good, informed decisions about what's appropriate for them individually as regard to some of these procedures in emergency or life-threatening situations.
Thanks to the work of many agencies, the physical and emotional pain some people endure at the end of their life may soon become a little more bearable. Also remember, the DNR order is not written in stone. Once signed, you can still change your mind. All you have to do is ask. And insurance companies will not be allowed to cancel your policy if you choose not to be resuscitated once you've signed the DNR order. The law should go into effect next spring or summer.